stroke doctor, and he inputs this device, vagus nerve stimulator, for patients with epilepsy, severe epilepsy. It can also be used for depression. According to www.cyberonics.com, 1 out of every 100 people in the United States has epilepsy. 35% of them have seizures that are difficult to treat. I'm going to speak to you today about the VNS implant and give you 3 informative facts about this product. 1, how the VNS implant works for patients. 2, the side effects for this implant and therapy, and the goals of treatment. Okay, so I got this. What is epilepsy? I got this definition off of wikipedia.com, but as I was reading it today, it's like, it's not for me. But I have another one that says epilepsy is repeated, unpredictable seizures that affect the ways the brain functions. It may also affect awareness, movement, and behavior. Epilepsy can cause patients to have to make several trips to the emergency room or to their primary care physician, because when you go to have a seizure, you'll fall or you'll break a bone. It can also cause depression in a patient, because epilepsy patients can't really live a normal life as to you and I would. A person with epilepsy sometimes has to take up to 10 medications a day. I got this quote. Depression is a common comorbidity for people with epilepsy. The VNS therapy may provide an additional benefit by improving mood in some patients. Morris GL. I got evidence-based guideline updates for the vagus nerve stimulation for the treatment of epilepsy. How does the VNS implant work? The VNS implant therapy is delivered by a small device that is similar to a pacemaker that sends mild electrical pulses to the vagus nerve in the neck. The vagus nerve then sends the electric pulses to the brain. Then the VNS delivers these periodic pulses all day long, every day, to potentially reduce or eliminate the seizures. I interviewed Dr. Keith Clark, which is one of the physicians that I work for, and he said that this research was found from a man who was using arsenic on dogs to cause them to have seizures. Then once they would have the seizures, he would put electricity to the nerve, and he realized that he could turn the seizures off and on with the electricity. The treatment goals for the VNS implant is to reduce the frequency and burdens of seizures and improve the qualities of life. It will help reduce the number of hospitalizations with long-term control with minimal side effects. Patients use the VNS therapy typically to continue they'll use it for long term. According to Steve Carroll, who is one of the Cyberonic reps, the number of patients who choose to get the device reimplanted is 71%. The side effects: difficulty thinking, learning, remembering, sleepiness, weight changes, liver and kidney problems, depression, dental problems. Like any other medication, of course, this is going to have a side effect. When you do the surgery, according to Dr. Clark, you can also have a side effect of hoarseness, a paralyzed vocal cord, some shortness of breath, and sometimes even coughing. These side effects do diminish over time. Usually whenever the electric shocks you, they also have a magnet that they can use to put on the device. The magnet is used, the magnet that is used provides on-demand stimulation to help reduce the severity of or length of time of the seizures. This product is used to help people with very difficult and hard to control seizures. There has been over 100,000 vagal nerve stimulators implanted. The implant does not cure the patient, but it can help control their seizures and reduce the amount of medications that they have to take daily. With this implant, with severe epilepsy, can have less seizures and better quality of life with less trips to the hospital.